morning, everyone. How's everybody doing today? Good. Excited to talk about human waste, I see. Oh, good. So, I'm wearing a uniform of the U.S. Public Health Service. I'm assigned to the national parks. Been working for the national parks. Is this on?
Not good. It's just for reporting.
Oh, it is. Okay. I'll go back here. Is that better? Okay. So I'm with U.S. Public Health Service. I wear a uniform of it looks like a Navy uniform, but there's about 6,000 officers assigned to different federal agencies within the U.S. And there's 7 uniform services. We're one of those. And NOAA, National Oceanic and Atmospheric Administration, is another uniform service. So that's where the uniform came from. We started a couple hundred years ago with the Sailors Relief Act, and we were assigned to Navy vessels at that time. So my role with the National Park Service is encompasses a lot of activities. Basically, I'm the public health consultant for the park. I'm not a regulator. I provide oversight and assistance to national parks for public health issues. And I'm located in Seattle, Washington, and Dawa Sherpa was talking about taboo and issues with human waste, caca, we're going to call it unca, poop. So we also in the U.S. have those taboos and issues with human waste and disposal, but we're moving forward, and part of that is trying to educate the public. And one of these, King County of Washington has put together this little video of some information about human waste, and these are flush toilets basically. So if we could possibly play the video.
Gonna flush my trash, only put TV in my toilet. I'm not gonna cause a sewer backup. This is flushing awesome. Never floss or hair, they don't go in there. Cleaning or facial wipes, don't flush them cause static pipes. Tampons or maxi pads, in toilets they are bad. Condoms or any grease, put them in the garbage please. Anything that isn't toilet paper or human waste clogs your sewers. So avoid constant visits from a plumber and protect our beautiful Puget Sound. Let's keep trash and wipes of all kinds out of the toilet. This is Flushing Awesome. Visit FlushingAwesome.com to learn what you should flush away. Brought to you by the King County Wastewater Treatment Division.
I don't know how I followed that up with. I was going to do a little dance move, but I don't think you want to see that. So there's my title. I did a study back in 2003. I was wondering where all the poop was going, and there was no national database for any of this information, so I kind of did a descriptive study of the collection and disposal of human waste. So I want to talk a little bit of background first. In my outline, I want to talk about basically wastewater methods, where the National Park Service has rules and regulations. I want to talk a little bit about that. Visitor data. Collection methods, I want to talk about 2 different examples. Then I want to get into the public health discussion about pathogens and human exposure, not just for the visitors, but for the people that are actually going in and cleaning up those sites, some on a daily basis. So we all like the backcountry to be unimpaired, so the Park Service mission is for the enjoyment of future generations. So they want to see each visitor that comes into a national park see what it looked like without any human degradation of the site. So some of the I'll discuss some of these toilet issues. We use pit toilets, barrel and fly out, composting toilets, I have it in quotation marks, vermicomposting, something that Jeff Hill will be talking about later on, but as we progress with this, I think the better definition is a urine diversion toilet, moldering toilets, cat holes, smear tactic, low tide drop zone, bag out and pack out. You guys have Biffy bags and rest stop examples. And of course, Rogers Clean Mountain Can. So this is just a picture of a now defunct manufacturer, Romtech, developed these for fly-in to alpine regions where people would utilize these where there was no soil on rocky terrain, so we could collect the human waste and remove it. Little definition of the Office of Public Health. We're an agency within the National Park Service, and we managed, funded, and operated by the National Park Service. This program is primarily staffed with commission officers on detail to the agency from the United States Public Health Service. It is a national activity headquartered in Washington, D.C., with field staff located throughout the United States. There's over 401 park units, and we have, I believe, about 7 regional offices, so there's 7 officers and maybe 3 officers that are in parks that cover this, like a county health department for the whole National Park Service system. So what we do is disease surveillance, on-site evaluations, consultation, policy guidance, coordination with local, state, and other federal health jurisdictions, and mainly we assist the park superintendent who has the authority to make changes within that park to protect and promote visitor health. The National Park Service is divided into a management system, and that's each level. Level 1 would be the highest priority, level 2 and level 3, and so on. So level 1 develops management policies, level 2 develops director's orders, and level 3 develops reference manuals and handbooks, etc. So we have committees within the National Park Service Public Health Program to develop these reference manuals to help superintendents manage and maintain the parks. In our reference manual 83F, it deals with backcountry, and National Park Service managers will reduce the risk of disease transmission to park visitors and staff while providing opportunities to enjoy the experience in the backcountry. And these guidelines are intended for the partners and operations to ensure minimum standards for public health are maintained in the backcountry where front country standards are not achievable. We deal with food service, with concessions groups that handle lots of visitors, maintain quality food in the backcountry, where we can't expect them to follow the same exact standards as we would at a modern restaurant that's on the highway system, where they have power and running water. So there are some nuances that we allow for, like the river guided trips and things like that provide food and waste and solid waste, human waste disposal. Human waste disposal will be safely disposed of in an approved manner in compliance with the requirements of the local National Park Service unit. So we understand that each Park Service unit can be unique in its location, geography, and availability of resources. So we allow the park superintendent to evaluate. We make recommendations and they decide which methodology they'd like to use. So human waste is regulated by state or local jurisdictions. EPA would be like for your wastewater treatment plants. State or county would be for your local small systems, and then the National Park Service would regulate their own backcountry waste for like human waste removal. So there's no really regulations other than being able to take the waste safely and properly out of the locations and relocate them to treatment options. So for compliance with local NPS, we get input from the park, appropriate and effective for that location. And a couple examples I'll talk about is Grand Canyon and North Cascades. Backcountry is defined within the National Park Service as one or more primitive or wilderness areas which are reached primarily by hiking, boating, or horseback. And so let me look at some of the statistical data from 2012. I did a 31-year average of visitation in the national park, and it averaged about 275 million visitors on an annual basis. In 2012, that went up to about 282 million, and there was a peak in 1999 of 287 million visitors. And those are annual trips. There is a category in statistical evaluation of backcountry overnights, and the 31-year average was about 2 million visitors on an annual basis. And in 2012, it was 1.8 million visitors, and that's less than 1% of the total visitors that go into the national park are actually going into the backcountry. But it's still 1.8 million is a significant number of people. I looked at about 102 parks in the nation have availability for backcountry visitation for overnight stays. That's about 1/4 of the total national parks in the system. So that's just an iteration of how many people are going into the backcountry again. So we're broken down into different regions: Southeast, Pacific West, Northeast, National Capital, Midwest, Intermountain, and Alaska. You can see Southeast as these are all recreational visits, over 60 million people, and then to a low of about 5 million in Alaska, 4 million. So backcountry overnight stays, the number one park in the U.S. National Park System is Grand Canyon with over 300,000 overnight visitors. Lake Mead, and then Yosemite, Great Smoky Mountains, Glen Canyon, Canyonlands, Olympic Park goes down the list. I just ran out of space, so I stopped at 17. So this is just a pie chart of that statistics. So you can see Grand Canyon is a little over twice of what the next park has as far as backcountry overnight visitors. And these are statistics from 2012 versus 2003. Grand Canyon leading the way with 300,000. Back when I looked at it in 2003, it was about almost 250,000. So on down the list just kind of gives you a So let me talk a little bit about the collection and disposal of human waste. This is a site, beautiful vista from the toilet. You don't get much privacy, but what a view. So let's go. Human waste will be safely disposed of, so that's our mantra: approved manner, compliance with local input from the park. You have to remember that information. So North Cascades manage collection system ROMTech toilets in alpine and subalpine for 25 years. Every park seems like it has a champion. Carrie Cook has been in the park. Her father has worked in the park. He's retired now, but she's carrying on the effects of his involvements, but she's done a study on human waste. Grand Canyons, that's the other example I'm going to talk about a little bit. They have everything's carried out by the river rafters and is disposed of off-site, and similar but different terrain. So this is the old ROMTech toilet. 35-gallon vaults were used to collect waste from wall-to-wall toilets. Park uses Romtech at helicopter-friendly sites. So there's not only are they collecting this waste, but they have to remove it via helicopters off the mountain. And unfortunately, the Romtech toilets are no longer manufactured. In a study, 8 of the 16 units were, Kerry Cook did the study, and 8 of the 16 units were at 50% capacity. Longer a unit was in service, the greater the pool pile. So that's a duh statement. As number of users increase, so does the moisture content. So that's you know, you may think that's, you know, yeah, so what? Okay, we know that. So this slide is just corresponding the different moisture content to average visitation. So you can see people aren't just using those to poop in, they're peeing in the toilets. And some of them did have leaky lids, so we get some rain in the northwest. So may have been a little bit of confounding factor, but I think most of it was because of you know, people aren't just taking a dump in the toilet, they're also peeing in it. And so the new toilet was developed because in the subalpine area, she felt that these were effective means, and there's no place to dispose of the urine because of the low soil density or no soil in the rocky terrain. So she designed and manufactured a new toilet, and these, from what I hear, are working really good up in the Alpine. And there's Carrie. She's great. If you've never met her, she just real down to earth and real practical. So these are working really good. So she is able to champion. It's a larger version of the Clean Mountain can, I think, from Rogers Design. And so here's the Grand Canyon River, completely different environment. You're on the river for 7, 14, 21 days, and they're packing all the food in and all the human waste out. So they typically haul it to a wastewater treatment plant, or you can clean your poop cans at these scat machines, and they're look like a big industrial-sized dishwasher where you put a bucket in them, and when you shut the lid, it actually dumps the bucket content into the container, and it's ground up and sent on to the to septic tank and drain field. So these are typical sites where you would do your business, and as you can see, you know, there's not much availability for, I don't know, privacy. Also, there's not much availability as far as hand washing facilities and things like that. So this is, again, just statistics of how many users there are in the backcountry at Grand Canyon. And the totals are down here. 09 versus 2013 numbers I got so far. So it looks like they're a little bit down from 2012. Another picture of a river runner with, just has the supplies. So we try and make sure that they're hauling food on one, as much separation as we get between the food haul and the waste haul, human waste haul. And suitable backcountries, again, we're talking about a lot of different options. And so how much do we produce when we go out in the backcountry? We're producing about 0.4 to 0.7 pounds per day. And bacteria are responsible for about a third to a half of the dry fecal weight. And studies showed that a direct correlation between gender, body weight, age, and bread consumption to fecal weight. So that was kind of interesting. So about 35,000 visitor nights for a total of 15,400 pounds, or about, this is not annual, this is 7.7 tons of human waste. And in 2009, I looked at the average over 31 year. It showed about, of all the visitors in the backcountry overnight stays, about 872,000 pounds of poop, or let's see. So what kind of issues do we have in the backcountry as far as exposure, public health issues, disease-causing pathogens, and human exposure? So bacteria and pathogenic organisms survive or are affected by moisture, type of organism, nutrients, temperature, sunlight. So these are all, if you have high moisture content, you get great growing conditions, you're going to see an increase in bacteria. So bacteria and pathogen lack of moisture content around 10 to 20%. Worm eggs can exist for years in soil. Some cysts can last for several months in moist soil. Some examples of organisms and survival rates. Coliforms, we heard a gentleman talking about, he was getting coliform samples in Tanzania, 38 days in the soil. Salmonella up to 120 days in the soil. Shigella, 42 days in wastewater. And one of the biggest culprits of illnesses in the backcountry is probably enterovirus called norovirus. It's very resistant to desiccation. It's very resistant to cleaning agents, and it will pass through a modern wastewater treatment plant without little effect. They've been able to isolate norovirus in water in the Grand Canyon. Click the right button. Nutrients increase survival rates. Low temperature favors survival, so the survival of gram-negative and gram-positive species was similar. Bacteria survival was shortest at 25 degrees C, most case longest at 4 degrees C. Exposure to sunlight increases the death rate. The greatest to least inactivation, enterococci, fecal coliforms, Ecoli, somatic colophages, enteric viruses. So, I'll go back. So as you can see, the enterococci and fecal coliforms are very susceptible to sunlight, and the least are viruses. So that shows that norovirus seems to be one of the issues. So how do we get exposed to these pathogens? Routes of entry: inhalation through the lungs into the blood system, absorption. It can be exposed through the skin or eyes. Ingestion, eating it through fecal oral route, and that can be a big problem when we're talking about backcountry because of the lack of hand washing facilities and lower hygiene standards. Injection, that's through puncture wounds such as broken glass, needle, and accidental knives. So we try and outfit, we're concerned with the National Park Service workers, so we try and outfit them with the proper protective equipment. A visitor rely on the visitor to self-monitor and obey signage directions, provide safe methods for collection and disposal. We expect them to read signs and act accordingly. Signage doesn't always work. We require pack in and pack out. There's a system to regulate, such as permits. We monitor for disease. We have stations, we have clinics at Yosemite, and there used to be a clinic up in Denali, and we rely on park rangers or climbing rangers quite a bit to report incidents of illness. Backcountry staff, they're regulated by National Park Service rules. We recommend vaccinations, health care provided, and injury prevention safety requirements. So our vaccination recommendations for MPS workers come from the Centers for Disease Control, determined on a case-by-case basis. The number one is typically tetanus is recommended for maintenance workers and other employees. Hepatitis A is not normally recommended for sewage plant workers or others where the risk is very low. Although you can have a job hazard analysis done, and based on that job hazard analysis, determine what the worker, what vaccinations would be required. So where does it go? That's not one of my kids, so don't worry. I didn't. Final treatment and disposal methods. Like I said, I did a survey in 2003 to find out. I called people, a lot of labor on my part to find out where it was going. Each park knows kind of their own methodology, but they didn't, like I said, they didn't have any national data for it. This is just kind of it broken down real simplistically. Cat holes, pit toilets, almost 50%. Disposal and wastewater treatment plant was almost 50%. Cat holes, pit toilets were 36%. 9% was other, and we do have incinerators in some of the parks. That was in 2003. I haven't done a follow-up study for that, and that's probably due this winter to do that. So again, this is the methodology for collecting and treating. 3% treatment plants, septic tanks was 20%, cat holes 11%, carry out 15%, evaporative vault systems 22%, composting toilets 14%, pit privy about 15%. So at the exit strategy meeting, I got to meet Jeff Hill, and he was working on his study about the urine diversion toilets, and it was like an epiphany for me to find somebody that was passionate about getting the science behind things, because we have been lacking in science in this part of the industry for a long time. So I think his research has greatly affected how we move forward with what we're doing with human waste. Basically, our backcountry sites are load-bearing on people that are actually hauling this stuff out on a daily basis, monthly basis, semi-annual basis. So if we can reduce the weight, because the contents is typically, it's not allowed to be put back for soil remediation in national park sites. It has to be hauled out and disposed of somewhere else. So pit privies are an exception to this. We have some places where you can dump your waste or human waste in high in marine environments. If you're out kayaking in Glacier Bay, you can go to the high level of the marine environment where the tide's coming in, and it'll wash it away. So normally we're not allowed to take this waste and turn it into compost and put it back into the soil in a National Park Service. There's real strict regulations, especially if you're in a wilderness area. The regulations are very, very strict. So Jeff has been, his work has really opened my eyes to options to reduce the weight of waste. I've looked at a lot of these composting toilets, and they're basically a murky mess of black goo, brown goo that is, I wouldn't want to clean it out. I hate to ask a park employee to clean it out, but they really don't separate the liquid from the solids. Carrie Cook's example is really good because there's minimal exposure to the workers. So that's what I'm concerned with, about the exposure of pathogens to the visitors and the workers that are using these facilities. And so collection method is very site-specific and dependent on local conditions and resources. Transportation costs are an important aspect. Systems must be dependable. Broken is not an option in the backcountry. If it's broken, you're going to find a place to go to the bathroom, and pretty soon it's going to be littered with little landmines all over the place. NPS Backcountry must remove or treat approximately 522 tons of human waste annually. Personnel that are willing to go out and do this job, education, inspection, and routine operation and maintenance, methods that reduce waste, weight, decrease costs significantly, and we've got to worry about worm, egg, and viruses are the most difficult to eliminate and treat. And out of the order sign on the backcountry toilet is not acceptable. And that was it.
Thank you.
Yes.
Do you happen to know the way to retrofit the ROM text to be a urine diversion? And is it acceptable to divert that separated liquid into the ground?
I think so. We have drain fields in National Park Services where they separate the waste in a big septic tank, separates the solids in the tank, and the liquid waste goes into leach fields. So we're doing it already throughout the National Park Service. So I think in the backcountry it's just finding the proper methodology to do that. And if you start with a ROM tech, you're going to be hindered. So I think you need to maybe rediscover a different type of toilet and structure that can be utilized in the backcountry. And I know they've struggled with issues at Mount Rainier and other places, but the toilet system that Jeff has designed is being utilized this year for the first time at Glacier Bay National Park. So we're keeping an eye on that to see how that's going to work out. They've dug a pit and for the human waste, and the urine's diverted into a small footprint where it dissipates into the ground. So if you have soil and availability, I think that's a real good option for you to use and think about.
I actually work at North Cascades, and we have a couple of those new ones, but they're pretty cost prohibitive. So
Okay.
mostly what we have out there is ROM techs.
Okay.
And try as you might, you can't get people to not.
Right. Yeah. And you're paying to haul the liquid waste out, which is expensive. So I think maybe Jeff's done some research on this. Maybe he can help with that. I don't know the specifics as far as converting those, but I know he's done some conversions in pit toilets, things like that. So there is some options there. If you have but the ROMTech is pretty structured. I'm not sure if, you open the lid, he's got a device where like a swiper, it swipes off the poop, and the urine's diverted off the splash pad into a pipe. But this was all going on when Carrie was already had the new ROMTechs developed. So I'd be happy to work with you because I cover the Pacific Northwest, so I'd be more than happy to help you out. Yes?
So is Carrie's system total containment?
It is.
Okay.
Yes.
And then it's pumped out or removed, there's not an attempt to compost there, it's just like a vault.
Right.
And then it's removed.
It's like a big septic tank. They hook it up to a helicopter, it flies to Marble Mount in North Cascades where a septic tank pumper comes in and sucks it out, hauls it away. Yes.
So on the old ROMTech trail composters, were the only shots that people need tetanus?
Yes.
They don't need hepatitis A?
No. And you can have a job hazard analysis done to ensure. I know some of the parks have other duties assigned, and if they found sharps like needles and broken glass and they have exposure to that, you might need to have hepatitis A vaccinations. Yes, sir.
That stuck my head in a lot of toilets. I think anytime we have someone interacting within a couple of feet of fecal matter, they should have a tetanus shot. Given all of those inhalation, injection, and when you're raking through to get the trash out, so compost, there's a real risk there.
So I think a lot of backcountry rangers end up, well, obviously doing that job.
Yes.
And not as aware as in facility management, I think, of some of the risks.
Yeah. I know I don't get a chance to talk to everybody when I go do a park site visit. I try and talk to as many people as I can, but most of the time I'm with the facility management team looking at the front country. I do get into the backcountry occasionally, but not as much as I should. So.
Yeah, I think my takeaway from the last conference was there wasn't that bridge between the backcountry and facility management.
Right.
And we can strengthen that.
Yeah. I encourage that dialogue whenever I go out. Yes?
Your numbers for how many people visited the backcountry, like Grand Canyon, they're overnight numbers. Is that one individual or is that individuals collectively?
That was overnight stays, so it could be, from what I took on the statistics, I can go back and look and give you that information. I'm not really sure. I think it's just overnight stays. It doesn't talk about, it's hard to track it, so I think it's overnight stays based on the permits that they issue.
So like one person might stay 16 nights and they only got counted one?
Yeah, that could,
Okay.
yeah.
Thank you.
All right. Anything else? Okay. Yeah. Thanks.